So next we will see about quadratus lumborum muscle. It originates from the iliac crest and iliolumbar ligament and inserted into a inferior border of 12th vertebra and transverse process of the L1 and L4 vertebrae, and its action is bilateral contraction of the 12th rib during inspiration and extension of the trunk, and its unilateral contraction of the lateral flexion of the trunk. So ask the subject to stand in a comfortable manner and then cross over the both the legs and hold the object in both the hands and slightly turn towards and slightly lean back to feel the maximum level of quadratus lumborum stretch. Hold for 30 seconds to feel the proper level of stretch. Relax. So next we will see about oblique muscle stretch. It originates from the 5th to 12th rib and inserted into a iliac crest. Its action is flexion and contralateral side of rotation of trunk. So ask the subject to sit in a comfortable manner to do the cross leg sitting and slightly turn over. Ask the subject to hold the couch at the maximum level to feel the external oblique muscle. Hold for a 30 seconds to feel the proper level of stretch and relax to a normal position. So next we will see about gluteus maximus muscle. It originates from the posterior surface of the ilium, inserted into a gluteal tuberosity of the femur. Its action is hip extension, axial rotation of the hip and hip abduction, adduction also. Ask the subject to lie on her back and to do the knee to chest position and hold the working leg and hold for 30 seconds to feel the maximum level of gluteus maximal stretch. And relax. Let's see about gluteus medius and minimus muscle stretch. So ask the subject to lie on her back and to do the hip adduction and external rotation and hold the hand on the other side. Give some resistance to feel the medius and minimal level of stretch. Hold for 30 seconds to feel the proper pull of the muscle and relax. So next we will see about adductor longus muscle. It originates from the border of the pubis and then lateral border of the pubic crest and then lateral to the symphysis pubis. So action is flexion, adduction and external rotation of the hip. So ask the subject to sit in a comfortable manner and do the maximum abduction of the hip and then feet together apart and hold the feet together to feel the maximum level of adductor muscle stretch. Hold for 30 seconds to feel the proper muscle stretch and then relax. Bring back to original position. Let's see about piriformis muscle. Originates from the anterior surface of the sacrum and gluteal surface of the ilium and it's inserted into a greater trochanter of the femur and its action is external rotation and thigh abduction. So ask the subject to lie on her back do the knee flexion on the other side, cross over to the stretching side and maximum pull over the doing side to feel the maximum level of piriformis stretch. Hold for 30 seconds to feel the proper level of piriformis stretch. Relax to the normal position. So let's see about hamstring muscle. It originates from the lateral surface of the ischial tuberosity and inserted into medial condyle of the tibia, and its action is knee flexion and extension of hip. Ask the subject to lie on her back and lift the right leg. Do the maximum level of hip flexion and knee extension. Ask the subject to hold the TheraBand. To feel the maximum level of pull. Hold for 30 seconds. And then relax. Come to a normal position. Now we are going to discuss about calf muscle. Its action is plantar flexion of the ankle and foot. Ask the subject to facing against the stabilization part and one foot on the stabilization part and hands hold on together and slightly lean forward to feel the maximum level of calf muscle stretch. Hold for 30 seconds to feel the proper calf muscle stretch and relax and bring back to its original position. So now we are seeing a iliotibial band. So it originates from the lateral surface of the external hip and it inserted into a iliotibial tract. So its action, extension, abduction, lateral rotation. Ask the patient to stand in a comfortable position and then do a leg crossover to the other side and slightly bend your torso and add a stabilization on the pelvis to feel the maximum level of IT band stretch. Hold for 30 seconds, relax, bring back to its normal position. So next we will see about quadriceps muscle, and it has four muscles: rectus femoris, vastus medialis, vastus lateralis and vastus intermedius. So its action is hip flexion and knee extension. Ask the subject to stand in a comfortable manner and do the knee flexion and hold the ankle part. Feel the quadriceps muscle stretch. Hold for 30 seconds. Feel the proper quadriceps muscle stretch and then relax, get back to original position. Next we will see about tendo Achilles. It's origin from the median and lateral condyle of the femur and it inserted into a calcaneum and its action is plantar flexion. Ask the subject to sit in a long sitting position and hold the TheraBand and place the TheraBand on the sole of the foot and pull over it to feel the maximum level of tendo Achilles stretch. Hold for 30 seconds to feel the maximum level of tendo Achilles muscle stretch. Relax to the normal position. So over the past 3 videos, we'll see here stretching for upper limb, lower limb and back muscles. Thank you for all your cooperation and thank you for the model also.